Hello, I am Urologist Ömür Erdem Akkaya. Today we have a short video presentation on age difference and erection problems. In marriages or long-term relationships, there can be an age difference. When we look at why, there are of course many reasons. Men want to be with younger women. Women may also be more likely to want to be in a relationship with men who promise future security and have steady jobs. Of course, no one can interfere with people's choices and preferences, but after all, there are people who get married at the age of 70 or 80. The person does not want to live his life alone, his children may have moved to their own house, he may be alone. He wants to hear someone's voice when he gets up in the morning, he does not want to wake up alone every day. There are many reasons. If there is an age difference between the couple, erection problems or problems with erection may become a little more prominent. The most common reason for this is the frequency of sexual intercourse. The younger the person, both male and female, the greater the desire or frequency of intercourse. This frequency decreases with age. In men, although the frequency of sexual intercourse decreases with age, the duration of sexual intercourse becomes longer under normal conditions. There is also the span of time after having an intercourse, which we call refractory period. Think of it like a cell phone, men definitely wait a bit between two intercourses. In the 20s it can be minutes, in the 40s it can be hours, in older ages it can be days or weeks. If the man tries to have intercourse again before the time is up after that intercourse, the man may fail at that intercourse. Rather than saying that the patient has erectile dysfunction, it is more accurate to say that the patient's refractory period, the length of time between two intercourses, is long. This is an important detail. If the person is not aware of this, he can come to the clinic and say that he has erectile dysfunction. Of course there are treatments that can be applied to shorten it, but the person needs to know this. He needs to know that this is a physiological process, a natural process. That being said, there are also cases like this, for example, a person who was not married until the age of 40, and did not have an active sexual life before, may have the opportunity to have sexual intercourse every day after marriage. If masturbation is at the forefront of that person's sex life, for example, when they begin a normal, active sex life in the long run, they may experience erectile dysfunction if their sexual performance is not very good. In the first few months, there may be serious problems in the couple's relationship. He then distances himself from his wife. He does not even want to make skin contact with his wife because he is afraid that he will fail if he approaches his wife during sexual intercourse, it becomes embarrassing, there is a feeling of inadequacy. This creates situations that damage the couple's relationship. Later, the woman is also affected by this event. The woman wonders if her charm is not enough, if she is not sexually arousing her husband, or if there is someone else. These situations are very important. If there is such a situation, both the man and the woman should be aware of it and get professional support as soon as possible. He should definitely see a urologist who deals with these issues. It is beneficial to apply as a couple. Because sometimes men and sometimes women have false beliefs in their minds. For example, sometimes women think that penile erection is something as simple as wiggling. Sometimes they want their partner to get hard without taking Viagra. When asked why, she says, "If I can stimulate my husband sexually, I want him to become erect, but not with stimulation from Viagra." That is false and incorrect arousal. But when you explain the physiology and nature of this, people accept it and can change their mindset. These are obviously situations that are more likely to occur when there is an age difference. When there is an age difference, these come to the surface more quickly. And sometimes there are situations like that, for example, the person is over 40 years old, he wants to get married or have a relationship, but he thinks he has erectile dysfunction and he's inadequate, he completely isolates himself from women. He isolates himself for many years. For years he makes no effort in this matter, he does not take a step forward. These people also sometimes come to the clinic, and we can see that they improve easily with treatment. Or, if we correct the wrong beliefs in their mind, the person can regain his life a little bit. An important point is that the couple loses skin contact and they begin to move away from each other. If the man does not touch his wife when he comes home at night, if he does not behave romantically or with erotic themes, there will naturally be problems in the relationship. Because the man sees himself as inadequate, he is afraid that he cannot get hard and does not want to touch his wife at all. In fact, even though he will not have sexual intercourse with his wife, he needs to make skin-to-skin contact. Both for his partner's hormonal status and his own hormonal status. Also, as one of our great coaches said, there are a lot of goal attacks in a game, but only a few goals. But it's those attacks that make the game entertaining. In fact, we can say that skin-to-skin contact, love bond, eye contact are some of these attacks. This is a very important detail when we look at it. This bond between the couple should not be broken in any way. Sexuality does not always mean sex. Romance and erotic themes are very important for women on the way to sex. As I said, the age difference can change all that. Generations can change. In these cases, there can be differences in perspective. After the sexual harmony of the couple is ensured, many age differences can be easily tolerated up to 10 to 15 years of age. As a result, the frequency of intercourse desired by the couple is more important than the frequency of intercourse. For example, if one party wants less frequent intercourse and the other party wants more frequent intercourse, then there is a problem. But if both parties want to have sexual intercourse less frequently, there is no problem. One of the important points is that the person who sees himself as inadequate or deficient should definitely see a urologist who deals with these issues, to get rid of the question marks in their mind. Thank you for listening. Kind regards.